Bismillahirrahmanirrahim. Assalamu alaikum. Today we will look at the CT scan and we will discuss the importance of clinical history as well as the subtle findings we can find in the CT scan. So this patient presented to ER with the extreme tenderness in the right hypocorneum, and doctors were thinking about acute cholecystitis or cholelithiasis. They ordered ultrasound. On ultrasound, um, there were no gallstones, no cholecystitis, and patient was referred for CT scan. So we have this history of extreme tenderness in the right hypocorneum. Let's scroll the CT, and when we are scrolling the CT, we can see a hypodensity in the left lobe of liver. It was of cystic density, fluid attenuation, so it's likely a small cyst, although very ill defined. When we scroll downwards, we see a calcification along the falciform ligament. This is another finding, but it does not explain the cause of the pain. But in the same slice, you can see some haziness in the fat here in the subcapsular region of the liver, and when we compare it with the adjacent fat, which is very clean, this is suggestive of a fat stranding. And when we trace this fat stranding, it is in the continuation with the falciform ligament. So this is the site of the falciform ligament here, and it is continuing with the fat infiltration. So this ill-defined area of haziness is suggesting of a fat infarction, and we term this as intraperitoneal fat infarction. This is the cause of the pain to the patient. It is a benign condition, and we have two entities under it. One is epiploic appendagitis, which is usually less than 4 centimeter, and epiploic appendages, which are part of the colon. They get twisted, and due to ischemia, infarction occur. And the second term is omental infarct, which is usually the infarction of the omentum. It is usually more than 4 centimeter. So we can use a broad term, which is intraperitoneal fat infarction. So this is very subtle finding. It is a benign condition. We will only give painkillers and follow this patient up. So this is the case of the intraperitoneal fat infarction or epiploic appendagitis, and it is important to know the clinical history. This finding can be easily missed because it is a very subtle. We have to compare normal with abnormal. So when we are comparing the normal fat with the abnormal fat, we see this trending. Thank you very much.